Scene 1 Introduction. Narrator meet Nancy, a 63-year-old woman who decided to improve her diet. She had a habit of snacking on chips in the evening, so she decided to swap out the chips for a healthier option. But little did she know that her choice of snack would cause her kidneys to start shutting down and affect the rest of her life. Scene 2 Initial symptoms. Narrator weeks went by, and Nancy started feeling more and more exhausted. No matter how many cups of coffee she had, she just felt like she was dragging herself through the day. Concerned, she went to her doctor, who ordered some blood work. Scene 3 Diagnosis. Narrator, when Nancy looked up her results, she was surprised to see that her kidney function was highlighted in red and labeled as abnormal. Just 8 months ago, her lab work was completely normal. The next day, Nancy got a call from her doctor's office asking her to repeat the blood work. Unfortunately, the lab results came back showing the same thing. Nancy's kidneys were filtering at a rate of only 25% of a normal kidney. At this rate, it wouldn't be long until her kidneys stopped working altogether. Begins. Narrator: so, the big question is, what's causing this kidney damage and can it be reversed? When approaching a patient with new kidney disease, doctors always think about 3 main categories of possible causes. Scene 5 Narrator causes. First, is there enough blood getting pumped to the kidney? In other words, is the person dehydrated, or do they have a problem with their heart or liver? Second, is there a problem with the kidney itself? This is a really long list, including everything from high blood pressure to cancer or lupus. Third, is something blocking the urine from coming out of the kidney, causing a backlog of pressure? In men, doctors often think about the prostate, but that's not an issue for Nancy. Narrator: the hunt was on to figure out which of these conditions was affecting Nancy's kidney function. She went to see a kidney specialist who listened to her story and reviewed all the investigations done so far. There were no signs of dehydration, heart or liver disease, and an ultrasound of the abdomen was normal with no signs of a blockage, so it looked more like a problem with the kidney itself. Scene 7 Narrator: but here's what's odd. Usually, when the issue is inside the kidney itself, you find clues within the urine sample, like high protein levels because the kidney filtration system is damaged, or misshapen red blood cells because of an inflamed kidney. But surprisingly, Nancy's urine was pristine, with no blood and no protein. As an aside, there are a lot of things that you can learn about your health just by looking at your urine. So if you want to learn more about practical things to watch out for, then take a look at this video next. Further tests. Narrator: Nancy's doctor ordered more tests. They looked for narrowing of her blood vessels, autoimmune diseases, and she even had a bone marrow biopsy to rule out cancer. Everything came back normal. 3 months went by, and her kidney function continued to deteriorate. Now, her kidneys were only functioning at 20% of normal capacity. Things were getting dire. Narrator: with no time to waste, Nancy had a kidney biopsy. This allowed her doctors to actually examine a tiny piece of her kidney under the microscope to try to find a clue. At first glance, it just looked like general kidney damage, nothing to really help with the diagnosis. But then they exposed the specimen to polarized light, and this is what they saw. Notice how it looks like someone sprinkled glitter on the kidney. Well, those are actually calcium oxalate crystals, and that's what's damaging Nancy's kidneys. It's a condition called nephrocalcinosis, nephro for kidney, and calcinosis meaning calcium deposition. Narrator: and for those of you who are thinking, isn't that the same as kidney stones? The answer is no. While kidney stones can be formed by calcium oxalate crystals, the difference lies in where the crystals form. Think of it like this: if crystals form inside the urine, it can form kidney stones. But if the crystals form inside the kidney tissue itself, it can cause kidney damage without actually forming any stones. The reason that stones form in some people and not in others seems to be related to the immune system. Scene 11 Narrator: diet analysis. Okay, so now we know what's wrong with Nancy's kidneys, but we still have to figure out why her body is forming these calcium oxalate crystals. When the pieces of the puzzle started coming together, it became clear. Not only was she eating a diet high in oxalates, mainly because of her cashews, but she was also absorbing so much of it because she was lacking calcium. Oxalates aren't just bad for the kidneys over time. When they build up, they can deposit in areas like the brain and the nerves. Scene 12 Changes in diet. Narrator: so what happened to Nancy? Well, she immediately stopped eating cashews and started tracking her oxalate intake. She soon learned that almonds actually have way more oxalate in them than cashews, so it's a good thing she didn't choose those to snack on. Nancy also increased her water intake to stay well hydrated and finally added a calcium supplement to her meals as an oxalate binder. Narrator, if you're examining your own diet, make sure that you're getting around 1,000 to 1,200 mg of calcium per day, depending on your age and gender. Ideally, it's best to get it through your diet, things like dairy products, broccoli, or fortified beverages. But if you're allergic to dairy products like me, or you choose not to eat them, then you may need to take a calcium supplement to make sure you're getting your daily requirements. And if you're not sure, then chat with your healthcare provider. Scene 14.
Narrator.
Nancy's improvement. Okay, back to Nancy. After just 2 months of making these changes, her oxalate levels completely normalized and her kidney function significantly improved. Unfortunately, her kidney function never completely normalized, so Nancy is left with mild chronic kidney disease for the rest of her life. Narrator, the moral of the story is everything in moderation, because even too much of a healthy snack can be dangerous. Just promise me that you're not going to leave this video thinking that you need to cut out all high oxalate foods from your diet. You really only need to focus on limiting them if you have a medical condition where it's necessary, like Nancy. Instead, focus on eating a balanced diet with enough calcium and plenty of water to prevent kidney stones. Fruits, vegetables, nuts, and grains are all part of a healthy diet.